Yes, Kalpita. Good evening, everyone. I would request all the panelists to please check their audios and videos. Miss Shobika, please test your audio and video. Hi. Yeah, it's good to go. Thanks. Miss Sujata, I request you to please check your audio and video.
Yeah, hi, Smriti ma'am. Hope you are able to listen to my voice.
Yes.
So hope my video is also clear.
Yes, it's clear. Thank you. Hello, Miss Tina. Welcome. Please, I request you to check your audio and video.
Yeah, hi. I hope this is fine.
I cannot see your video.
Just a sec. I'll just. Yeah.
Sure.
Is it better?
Yeah. Fine. Good to go. Thank you so much.
Thank you.
Hi, Dr. Radhika. I request you to please check your audio. I can see your video clearly. You're on mute.
Can you hear me?
Yeah. Good to go. Thank you so much.
All right. Perfect.
Good evening, everyone. A warm welcome to the 36th webinar of the webinar series on adolescent and youth. I'm Sharon Augustine, moderating with Aliza Asin. And like every webinar, here is the survey on your screen. I would request everyone to fill it, and it is also open for the panelists as well. अगर आप ये वेबिनार हिंदी में सुनना चाहते हो तो अपने स्क्रीन में दिए गए हिंदी इंटरप्रेटर को क्लिक कीजिए और वेबिनार हिंदी में सुने। Thank you.
Good evening, everyone. My name is Aliza Hassan.
And I am Sharon Augustine. We are the moderators for today. I once again welcome all the panelists, principal, teachers, public health professionals, and the health ambassadors. अगर आप ये वेबिनार हिंदी में सुनना चाहते हो तो अपने स्क्रीन में दिए गए हिंदी इंटरप्रेटर को क्लिक कीजिए और वेबिनार हिंदी में सुने.
Let me introduce you all with SHARP. SHARP stands for School Health Annual Report Program. It is a non-governmental pan-India health organization, and we have recently completed 21 years in this field. We work for the healthcare of students and children, which is professionally managed by eminent psychologists, educationists, nutritionists, counselors, and people like you and I who have vision to promote healthcare. In this webinar, we hope to discuss on the building healthy classrooms for students, promoting equity in health for all school children, innovating avenues for synergy between schools and parents, and role of corporate and civil societies in health promotion.
SHARP NGO being a public health organization, it is our foremost duty to control the rising incidence of communicable and non-communicable diseases through our various health promoting activities for schools and communities. Creating awareness about the healthy aspects of day-to-day life amongst children is one of the essential interventions to break the wheel and prevent diseases. To celebrate the World Health Day, and as the theme for this World Health Day is building a fairer and healthier world for everyone, we bring forward the topic for discussion, which is renewing the health promoting school approach to build a fairer and healthier world.
COVID-19 has left a big room to discuss over the subject. For the same objective of discussion, we here have with us our very esteemed panelists, Ms. Tina Raval, Dr. Radhika Batra, Ms. Sujata VP, and Ms. Shobhika Ghai. Few instructions before we go further. We will let each panelist speak first, and then we will have a question and answer round. All the questions in the Q&A round will be taken live. Please drop your questions in the Q&A box with the name of the panelist you want to ask to. The sharpest question from the audience will be given a gift hamper of rupees 1,000 from SHARP. Also, I request all the attendees to not flood the chat box with unnecessary messages as we tend to miss out the important ones. Also, you can post about this webinar as your story or post on your social media handles with hashtag webinar by SHARP NGO, so together we can aware more people on the subject. You will find the posting content for the same in the chat box.
Now, I would like to invite the first panelist of the day, Ms. Tina Raval, who will help us to understand health promotion at school, as she has 12 years of experience in the field of nutrition and public health. She's also associated with Public Health Foundation of India and Hriday. She has been involved in various research studies and programs focused on prevention and management of non-communicable diseases. She has also been part of various programs promoting health awareness and informed health activism among youth in India. We welcome you, ma'am. Over to you, ma'am.
Thank you, Sharon, for that introduction and giving me this platform to share my experience being part of this public health and being passionate about youth world. So if I can just share my screen, just a second. Yeah, I hope the screen is visible.
Yes, ma'am.
Yeah, so schools, of course, a setting of health promotion, social development, and learning, which we believe very strongly and need to be a little more enforced. So children and adolescents, I mean, why we are focusing on how health is related to education. So world is facing a triple burden of diseases constituted by unfinished agenda of communicable disease, newly emerging, re-emerging of diseases as we are just currently facing, as well as the unprecedented rise in the non-communicable diseases like diabetes, which includes cardiovascular diseases, etc. And the school children and adolescents are prone to a number of health impacting conditions. And these risky behaviors either start or peak during adolescence. So health and education are strongly connected, and healthy children achieve better results at school, in turn associated with improved health later in life. And behavior adopted during this year as a future parents may influence the quality of life and health of next generation as well. Therefore, investment in developing healthy behavior during this formative years will create a healthy productive adults in the future and deliver a rich social and economic dividends of the nations. Health and behavior and health behaviors are closely associated with academic outcomes. The studies have shown that health problems may limit motivation, may interfere with the learning, comprehensive health promoting school approach, poor health and malnutrition are important underlying factors for low school enrollment, absenteeism, poor classroom performance, and early school dropouts. There are studies which have shown that school-based physical activity have the positive impact on academic behaviors and associated performances. And dietary intakes, including regular breakfast consumption, lower intake of energy dense, nutrient poor foods, and overall diet quality is associated with academic achievements, and the increased risk of smoking onset associated with poor and dynamic academic performances. And of course, what we are facing right now is the heavy and disordered, like use of social media associated with the negative impact on the psychosocial well-being of and school performances of school students. Therefore, the good health and nutrition are not only essential inputs, but also important for the outcome of basic education for a good quality. So today we are talking about the health promotion, and health promotion in school setting could be defined as any activity that can be undertaken to improve and protect health of all school users. And the concept includes provision and activities relating to healthy school policies, which includes documentation or accepted practices that promote health and well-being. For example, the policies which enable healthy food practices to our school at the school level, policies which discourage bullying. Maybe some of the examples includes with that. The school's physical environment, which includes refer to the buildings, grounds, equipment, and the surrounding of the schools. The school's social environment, which we are just looking at the framework at this moment. So this is like a combination of the quality of the relationship among and between staff and students, and between the relationship between the parents and the wider community. It is about building quality connections among and between all the key stakeholders in the wider school community. Then includes a component around individual health skills and action competencies, and which refers to both formal and informal curriculum and associated activities, which includes knowledge, age-specific knowledge, understanding skills, experiences which enable them to build competencies in taking actions to improve their health and ownership for well-being for themselves and others at the community level, and enhance their learning outcomes also. The other section which includes and the component for health promotion is the community links, and the community links are the connection between the schools and the student families, plus the connection between the schools and the key local groups and individuals. Therefore, the appropriate consultation which needs to be like built in, appropriate consultation, participation of the stakeholders, which enhances the school, promoting behaviors among students and staff with the context to support their actions. And the one more important component for the health promotion is the health services around local and regional school-based and school-linked services, which should be to improve the ability of student and adolescents, or maybe the child health care and promotion through their provision of direct services to the students and including their special needs. Among adolescents, we have been looking at many prevalent issues, for example, tobacco use, and there are many studies which has conducted among this age group and has been shown results that there are tobacco use prevalence among youth. For example, the recent GATS survey has revealed that there are 4% of adolescents who are currently using tobacco in any form of tobacco. Physical inactivity, like the mean screen time of among adolescents, it's 3 to 3.8 hours. And now because with the COVID measures and what at the school lockdowns, so I think that it has increased a lot. Approximately 50% of school children which do not met existing physical activity guidelines before the COVID area, and during COVID area, the physical activity has gone approximately nothing, as just null. The combination of nutritional status, I think in India, we have been facing a dual problem of malnutrition, which includes overnutrition. Like one of the systematic survey reported the combined prevalence of childhood overweight and obesity as 19.3, and the prevalence of, at the same time, the moderate of severe underweight was highest in India, which was like 22.7. So we all are facing a dual burden. So it's not only the nutrition status of physical inactivity, mental health. Nowadays, I think it is a big issue of what we are facing with the school kids with the current measures what we are taking. SRH issues for sure. I think there are 93 to 94% of adolescent girls and boys know that there is a one-step method of contraception. There is issues related to 2.6 girls, like 4.8 got married at the age of 15 at the community level. There is a prevalence of using alcohol among this age group. So current alcohol use, one of the study reported it is 8%. And the alcohol use among boys is 8.9%. So there are issues which are prevalent among adolescent and youth. Therefore, it is very, very important to implement some of the interventions and programs which not only improve their knowledge, but also give them the skills and ownership so that they can take this health promoting messaging to the community level also. So this is one of the model which we have been using our interventions implementation among adolescents, which includes the risk factors, the environmental risk factors, which includes there are weak implementation of existing law, weak health services, then extensive media influence, which promotes risky health behaviors, program and policies for sure. There is at the policy level, there is a need for enabling and guiding policies for scaling up implementation of the existing laws, programs, at the same time protecting laws for the gender, improving health delivery, mass media campaigns, of course, effective and uniform IEC material, youth advocacy and empowerment. At the same time, there are approaches which are interpersonal risk factors, which may influence by the community level approaches, and there is a individual risk factors which can be improved with the individual level approaches, which includes health awareness, life skill-based training programs, vocational training programs for out-of-school adolescents, especially tailored intervention for vulnerable laws and victims that we have been implementing. And at the community level, there are comprehensive school health programs, community-based interventions, peer and family support groups, which is really, really important to control the risky behavior, especially among adolescents and youth in this age group. Just giving an example, some of the projects which have shown successful among adolescents and decrease in the risky behavior. One is the project METRI, which is like a mobilizing youth for tobacco-related initiatives in India. This was a multi-component tobacco prevention and control intervention, which was implemented in Delhi and Chennai schools. And approximately 14,000 adolescents included or involved in this study. And the study intervention has shown a decrease overall current tobacco use increased by 68% in the control group and decreased by 17% in the intervention group over the study duration. And the intention to smoke increased by 5% in the control group, whereas intention to smoke decreased in the intervention school by 11%. So there are studies, I think, just to promote why it is important to be more healthy, why it is important to adopt a healthy lifestyle practices. In continuation to that, it has also informed, like evidence has proved that informed the policy and programs, and school health programs formed a key component for the National Tobacco Control Program. I mean, the METRI, the results were also considered for this National Tobacco Control Program. Along with tobacco, so there are programs which focuses around diabetes awareness and prevention. This was a small pilot which will implemented in the schools or government schools and private schools, which have included the orientation workshop, interactive classroom activities being facilitated by the peer groups, which includes the various interactive activities, poster-making competitions, pre-post survey. And the pilot has shown change in the vegetable consumption. Like, for example, at the baseline level to the end line, there is an increase in the intake of vegetable consumption, and there is a decrease in the unhealthy food consumption at the same time. So looking at the graph and looking at the results, the program is now being scale up pan-India, and we have been implementing this program pan-India in different schools, showing the results of increase in the vegetable and the healthy food stuff and decrease in the unhealthy food item. In the row, there is one more program which we have implemented. It's called Kids and Diabetes in Schools. And the key objectives for this program was to foster a safe and supportive environment for children with diabetes to manage their diabetes and avoid discrimination. And at the same time, to raise awareness of diabetes and the benefits of healthy diet and physical activities among school age children. So it was implemented with the students of grade 1 to 9. So there were teacher training, which we have involved the usage of insulin as well, like how they can check their normal blood sugar level. So the training included the hands-on training also from like one of the physician who was present as a part of them, just giving them the training that how they can use a glucometer, along with the other interactive activities, which was implemented to reinforce the importance of being physically active and why it is important to eat healthy diet, because reinforcement at different level, it is very, very important. And because teachers, principals, all the school staff, they act as role models for their children. So it is very important that how they are doing the activities so that the children can be motivated and can adopt similarly in their usual routine. The Kids Pack, what has been developed for students, for parents of children with diabetes and parents of children without diabetes, and for children. So it has included some of the components that the pack were reviewed by the Kids Working Group, which included the representatives from the government and non-government organizations. It was adopted to align with the Indian social cultural context. It was translated in Hindi for the government schools, pre-tested in government schools in consultation with the Department of Health, School Health Scheme and Education, brought on as both as key stakeholders. And Project Kids was implemented in 7 public and 8 private schools. And in total, approximately 1,149 teachers were trained in this program, and they were part of some of the State Council educational research training also. So impact to evaluate the implementation of Project Kids. So we have conducted a small scale qualitative evaluation study, which have shown that there is an increase in knowledge and awareness about diabetes among all the stakeholders. It has aided in reinforcing the information for behavior change, in terms of the school staff, parents of children with diabetes and parents of children without diabetes. Teachers' satisfaction was very high after Indian program implementation, and there is a massive demand to scale up the program. Again, this program also been like a scale up in other parts of India, just to reinforce about the importance of prevention and management of diabetes at the school level. There is one more project which we have just developed in collaboration with the Northeast region bridging the Northeast region for health transformation. So the project called Swasth Uttar Purv Healthy North India Northeast project. So under this, we have included all the themes like overall school health program, which included adolescent health, like hygiene and sanitation, adolescent reproductive and health and hygiene, mental health, substance abuse, injuries and violence, non-communicable disease, emergency care, which included again the model of teachers-led trainings, which being included the peer leaders also, and the implementation at the classroom levels. There is one more program which we have implemented just to see the impact of yoga on stress, metabolic parameters, cognition, which includes the attention and concentration in Indian adolescents. And we have included the students of especially board examination in that year. The study has been conducted in 2018, where we have included students from class 8th and 10th, and the results is being in the process of analysis. But the preliminary has shown that because of the pressure, the yoga sessions were really helpful for students who were in class 10th to keep them calm and just a little more relaxed for conducting their examination, to worry about their grade 10th examination. So it was implemented in Delhi and Chennai. It was again a school-based setting, which included the measuring of stress level using stress scales and salivary cortisol levels, metabolic parameters such as body weight, waist circumference, pulse rate, body fat, blood pressure. These were measured during the study, and adoption of a healthy lifestyle by focusing on improving dietary habits. So a survey was implemented to see their life, the kind of lifestyle they are leading with. And so attention span concentration using the cognitive psychometric test. And there were sessions at the level of school levels where the yoga instructor were especially employed to conduct this yoga session at the school level. To go with this, along with this, there is one more project which we are implementing, which included the project I Promise, that's promoting healthy lifestyle among school children. So it is like a promoting health literacy in schools. So this was implemented and pre-tested again in schools of Delhi, and being right now it is in the evaluation under RCT as a part of the randomized controlled test, what we are just evaluating at this moment. This included some of the videos like from the renowned endocrinologist, and there are activity manuals which included a small clippings for the students also to just to reinforce, especially for the younger kids, that why it is important and to reinforce the prevention. So if the time permits, I'll just give you a glance of like how the videos look like.
Meet Super Kid Aryan. When something goes wrong, Super Kid Aryan helps his class to set all things right. Aryan is the strongest, fastest, and most intelligent kid of his class. Now, to be the strongest,
The voice is not clear.
must realize that
So I can just try.
6, 7, 8 hours to be in school. About 30% of their living day, their parents have passed
It is still not clear.
only of their education, but of their child.
Maybe I can share it later, and maybe I would request the organizers, maybe if they want to share it, so maybe under another mode if you can use the videos. So that's perfectly fine. In the current scenario, we are just implementing this study, and I would like to invite all these teach schools who are just part of this webinar, and I would take this opportunity to disseminate this this study which we are doing to see the assessment of effect of containment measures and closure of educational institutions, social isolations due to COVID on well-being and education of adolescents and youth. The target audience for this again includes 11 to 17 for schools and 18 to 21 years in college level schools. And the medium is of course online in the current scenario. So I would request all the teachers to and welcome them just to part of this study. And I would request the organizers if they can help us maybe in disseminating the link. There is one more to this project. I think the learnings for us, I mean, maybe because we have been implementing, and always there is a learning steps for each and for every project, which includes first, it is very, very important that the approach should be a whole school approach, which improves, which ensures quality standard across the school and between the school's home and wider community. Very, very important. School parent community interaction. It plays a very important role, which includes continuous engagement, consultation with students, parents, community, and school staff. Intersectoral convergence, of course, it is an important criteria and priority for just to have the important partnership between health, education, and social sector. Theory-led and multi-component intervention, of course, to have that ownership of issue. It is not like something like we are just coming to schools and we are promoting this, but there is important to make them aware and how important for them to develop that skill so that they have that ownership of that project, that if we are not there, maybe they can just take up and they can just implement the activity at their own level also. Coupled with enhanced health knowledge, health promoting schools, national policy which brings sustainable behavior change, which is very, very important. It should not be a one-time activity, but it should be a sustainable, which something should be very long-term. Contextualization, what we have learned from our project, it is very, very important, of course. The implementation of cultural and contextually appropriate diverse learning and innovative teaching and learning strategies is very, very important. I think in one of the chat box, I have just read one of the query, which I think one of the teacher has raised, that how they can cope up with the mental health issues during the online classes. I think during the panel discussion, we'll take it up. So I think it is very important to contextualize whatever we are implementing at this level also. And of course, the capacity building opportunities for school staff is always a very important thing. Just to give you an overview, we are implementing one of the global youth conclave on April 20th and 21. So it is a 2-day conclave what we are organizing at Hriday, and Hriday in collaboration with WHO, World Health Organization, CRO. So maybe I can just request all the organizers to pass on the link, and if they want to be a part of this global event, so they are most welcome. And on this, I would say thank you so much and giving me this opportunity and to share my experience being part of this school community. I think. Thank you so much.
Thank you so much, ma'am, for sharing your views over the subject, very nicely and briefly explained. I would like to welcome our next panelist, Dr. Radhika Batra. Dr. Radhika Batra is a pediatrician in New Delhi. She is the founder and president of Every Infant Matters, a non-profit organization dedicated to the upliftment of disadvantaged children worldwide. Its a flagship program is preventing blindness in children by improving nutrition and dispensing vitamin A. Radhika believes in inclusion and health equality and wants to ensure ubiquitous access to health care for all. She's a Forbes Asia 30 under 30 honorary I1 Young World Ambassador, a trust change maker with the Thomson Reuters Foundation, Vidu Rising Star, and a change maker. Also, a Global Peace Index ambassador for the Institute of Economics and Peace, Sydney. Over to you, ma'am. We welcome you.
Hi, Eliza. Thank you for the introduction. Am I visible and am I audible?
Yes, it's perfectly fine.
Hi, everybody, and thank you, Sharp, for this wonderful opportunity to speak to everybody here today and to speak about such an important topic, about school and adolescent health. This is something which I practice on a daily basis and I see on a daily basis. So it's a topic very close to my heart. And I think Tina ma'am has already summarized all the aspects which we need to focus on going forward in the post-pandemic world. But I just, what I'll do is I'll just touch upon from my experience as a pediatrician what we see in the OPD and the kind of issues that we encounter with adolescents specifically and with children in general, which I feel that on a school level they can be addressed and they can be really, steps can be taken to combat those issues. So I'll just speak about them, and if the audience has any questions, please please feel free to ask me and stop me at any time. So I think the first issue which I'd like to address, and this is something which is it's a very prevalent issue, specifically in Indian communities, and that issue is of sexual abuse in children. So what we see, in our OPDs, we get a lot of patients. Mostly they are girls, they are boys also. I'm going to reiterate that fact that it's not only girls, it's also boys, but mostly it's girls. Mostly it's school-going girls in the ages of say 5 to 11, could be elder also, but mostly in this slightly more vulnerable age group, and they're not aware of what is happening to them. And most of the times the history is such that some classmate has inserted his fingers in her private parts, or some teacher has undressed her without her consent, or somebody has tried to feel her up, or do something which is not acceptable in and would qualify as abuse under the POCSO Act, right? So what I'm trying to say here is that this point of what is good and what is bad when it comes to touch has to be inculcated at the school level, and it has to be inculcated into the child's mind at a very early age. I would suggest as early as I would say 4 to 5 years of age, in a very very considerate and a very sensitive manner. These children have to be taught what qualifies as a good touch by a person and what qualifies as a bad touch, and the fact that if there is ever a bad touch, they have to raise an alarm immediately, right? So this is something which I have seen in my practice that it doesn't happen. Most of the times the history is such that the mother will come and say, ma'am, ये बच्ची 10 दिन से खाना नहीं खा रही है और ये बहुत परेशान है, किसी से बात नहीं कर रही है, बिल्कुल अपने में रह रही है, कुछ इसमें प्रॉब्लम है और हमें समझ नहीं आ रहा, हमने सब टेस्ट करा लिए, सब हमने देख लिया, हमें कुछ समझ नहीं आ रहा, इसको क्या हुआ, इसके साथ क्या हुआ. So then when we send the mother away and we speak to the child separately, we get to know the history that that someone had done some sort of unacceptable act with her, and that is what is causing her to be in this depressive and anxious mode. So what happens with children is that even though they don't understand the gravity of what has been done to them, that it is very very heinous, it's a crime and it qualifies as a crime under the POCSO Act, but they do understand that something wrong has been done to them, right? They may not realize that it is abuse, they may not realize that it is harassment, but they will understand, they will feel squirmy and uncomfortable about it. They will not like what is being done to them, even if they are at the age of say 3, I have seen a girl as young as 3 who has said, who has, understood that something wrong is happening, but has not been able to fathom the depth of the crime which has been committed. So this is something which I feel can be started at a school level, and let there be health experts. Let there be health experts like pediatricians, like counselors, like even teachers can be trained, to educate the children about good touch and bad touch. A few of the ways, which we have been propagating at Every Infant Matters, we're going to make a comic book which can be translated into several local languages, and which highlights the story of a girl, and what, it just talks her through what is a good touch and what is a bad touch. Another way to do it is, so these are all child friendly approaches, a comic book. Another way to do it is by dolls. So dolls is another way which has been approved by psychologists, that you can use dolls to illustrate what is good touch and what is bad touch by marking the points on the doll's body as red, right? So these are some things which we can do and we should do, because I would say 10 if I speak to 10 girls tomorrow, I think with all the women listening, if I speak to 10 of you, I think 7 of you will say that yes, we have been molested or abused in our childhood. I have been molested and abused in my childhood by the hands of a family member. And this problem is even more severe when it comes to family members, specifically when there is an extended family member who's not related by blood. This is what we have seen very commonly in our OPDs. So, I think the child should be trained in the way that they should raise an alarm immediately, whether it's an uncle, whether it's domestic help, whether it's a teacher, whether it's a co-student, it could be anybody. But they should be told that even if it is family, it is not acceptable. Even if it is, even if it is someone who for the last 30 years, it is sorry, for the last however many years you're alive, since your birth, it is not acceptable at all. So this is something which we really need to inculcate in the curriculum when it comes to health for students. And I think coming a point which stems from this point is mental health. And coming to that point, I would say that mental health issues we have been seeing in children as young as 6 and 7. It's not just a problem of adolescence. There are children who have mental health issues, and the mental health issues range from something as minor as nocturnal enuresis, that is passing urine in to clear cut psychosis, anxiety, depression. Everything has been seen in children. And what the problem in the Indian society lies with the taboo that is accompanied along with mental health. So we need to effectively break this taboo. We need to have conferences with parents, teachers, and the healthcare providers in the schools. We need to destigmatize mental health. We need to have regular mental health assessments by way of questionnaires, or by way of as child psychologists to assess the child's mental health. There are many ways to do it, which is of course beyond the scope of the discussion. But this is something which we really need to stress upon, that we need to have regular evaluations of a child's mental health, specifically if the child is exhibiting symptoms. Symptoms, of course, it could be being withdrawn, not performing, suddenly deteriorating school performance, dropping of grades, not talking to peers, not interested in school activities, not taking part in extracurriculars. These are all symptoms. And immediately the teachers must be trained to recognize these symptoms. Once the teacher recognizes it, she can raise an alarm with the parents, that often what happens is that the parents are working. They're not, the teachers are in fact spending more time with the parents than with the child than the parents themselves. So if teachers are trained to recognize these points, they can immediately take up a alarm with the parents, and then they can have they can schedule an appointment with the child psychologist, and they can make sure that they assess the child's mental health at a very early stage. What happens is that these minor issues left untreated in childhood lead to schizophrenia, psychosis, a lot of major mental health issues in adulthood. So we need to catch them at their onset. We need to break this vicious cycle of mental health being ignored and stigmatized and, considered a taboo in the Indian society. It's a conversation that parents need to have with their children. It's a conversation that teachers need to have with the children. It's a conversation that teachers and parents need to have with each other. So we all need to come together as a group and tackle these issues, uh, collectively, collectively, right? Third, and I think this is an issue which I have faced when I was a child. And in my school, what used to happen was that I was an overweight child, and I was constantly fat shamed by other students. Okay, that is accepted. Children are not sensitive enough to understand that a child can be different from the other children, and a child can be, still has to be accepted as one of them. That is expected of children. But then we have to, we have to break these barriers, and we have to promote inclusion and diversity. That is the point which I'm coming to. And what used to happen with me, at least, is that when I used to go for these health checkups in my school, I was, I was literally made to cry over there that, you are so fat, what are you eating? And, as a kid, you don't understand that what is healthy and what is not. It's up to your parents and your teachers to tell you. And even then, even when they try to, they try to force you not to eat junk food, not to eat, fried food. And you don't accept it as a child because you don't understand that it's wrong for you. So, we need to have a more sensitive and child-friendly approach to this issue of obesity, of, a child being shorter than the others, or a child being disabled, or having a malformation on the face, or something like that. So we need to promote these ideas of diversity and inclusion in childhood itself. We need to make children understand that, okay, not all of you look the same, but you have a right to be treated the same way, whether or not someone is good looking, whether or not someone is fat, whether or not someone is short or tall, or has a disfigurement or a malformation. You all have to be treated the same, and you all have to be included in the childhood activities, in the play times, in the sports section. So often what happens is that the fat children are selected last when it comes to team sports and on other games, and that doesn't feel good. It's not the child's fault that the child is fat. It's not the child's fault that the child is slightly different from the other children. And this collectively leads to distorted body image when you come to your adulthood. I know, because I have faced it. I still feel like I'm very fat because of all the years of bullying and all the years of fat shaming that I have been through. So these are just some points, which I thought and which I feel are important to be included in the conversation as we are discussing a post-pandemic world for children and adolescents, going forward, and how schools are going to, make it back to being the normal. So these are some of the points which I thought were important. And I'll just like to end with one story which happened recently in my hospital. I think this was last month, and it's a very shocking story, but then it kind of reiterates the problem I've been trying to highlight. So what happened that a colleague of mine was on duty in the emergency. We are pediatricians, so she was on pediatrics duty. She was told that a patient has come and some mishap has happened with the patient. And what had happened was that, and it's very sad to know, that the patient had come for a sore throat and a fever, which is a very common problem in childhood. And there were these two attendants in the hospital who were inebriated, they were drunk, and they took the girl child. It was a girl child of, I think, 5 or 6, and there was the girl child's mother. They took both the mother and the child to a separate room, and they said that corona ki जांच होगी पहले और उसके बाद ही patient को देखा जाएगा. And the mother, considering the current situation, she was very okay with the fact that there has to be a COVID test, right? So they took her, they asked her to undress, they asked her to remove her undergarments, and they proceeded to, probing the private area of that girl on the pretext of doing a corona test. Surprisingly and shockingly enough, the mother also did not understand that something wrong is happening with her child until it was very late. And once the mother, I think after a little bit of, I don't know when she finally figured out that something wrong is happening, it took her a while to raise that alarm. So this is what I want to highlight, that even mothers are not aware, because mothers themselves are so young. They themselves are so young. They themselves are sometimes not from educated and good socio-economic backgrounds. So we need to take this up as a community, and we need to tackle this problem on a, we need to tackle it as a emergency, I would say, because the next crisis is going to be, the next pandemic is not COVID, it's going to be mental health. And this is the only way that we can tackle this mental health pandemic, by by starting from the children, by starting from the formative years, by attacking the problem where it's just starting to brew. So this is all what I wanted to say, and I hope it was educational and enlightening enough. And if anybody has any questions, please do drop them in the chat box.
Thank you so much, Dr. Radhika, for bringing up the 3 points related to sexual abuse and body shaming, bullying, and mental health. Yeah, even these are some of the topics which is going to, it's something new and everybody has to do something for it collectively, as you said. Thank you so much. So, so the next panelist for the day is Ms. Sujata, VP, Principal of Delhi World School, Hyderabad. She has a strong experience of 25 years as principal, teacher, and administration. She has worked for different board of education and has been part of 200 plus workshop as a speaker and attended various workshops relating to children. We welcome you, ma'am. Over to you, ma'am.
Thank you so much. A very good evening, Sharp NGO team, all the panelists, and to all the participants who have taken time to attend this session. So I just have a quick, simple question to the audience. What's the difference between active and healthy? You can just drop in 1 or 2 answers just to check what's the difference between active and healthy. So if you all can, just drop in the chat box, I'll just go through. Because we have been talking, if we can expect some answers from you, then we'll get to know. Difference between, activeness and then healthy. Hope I'm audible to everybody.
Yes, you are. We haven't get any of the answers.
Fine. That's fine, audience. Okay, so healthy and active. So I'll just give you an example, because many of the parents come and meet me and then say that my child is very active, but he doesn't take any food. Okay, and then he messes up and then he doesn't take food. Even the teachers are facing a lot of problem when we had this physical classes, and then teachers are behind their boxes, their lunch boxes, their snack boxes, but the child is not interested to take any food. Okay, so then we need to understand like what actually is healthy and what actually is activeness. Activeness is something like, the child is having enough of strength, flexibility, and has speed, kind of power and kind of coordination and all. But when it comes to that healthy, it's something related to, intake, the food we consume and the kind of liquids we take. Okay, so then all this, why the child is in such condition, we need to understand that maybe these factors are, kind of situation, like the environment the child is brought up, the diet plan followed at home and at school as well. So in order to have a healthy classroom, which enables the students and teachers to be at their best physically, mentally, and emotionally, creating and maintaining this healthy classroom involves addressing of issues in a holistic way as a part of our ecosystem. So healthy indoor air quality, water, ambient sound in the classroom, lighting, cleaning, disinfecting kind of factors should be kept in mind for a healthy classroom system. So when we come to the physical healthy classrooms, childhood and adolescent obesity have increased dramatically in these recent years, especially during this COVID. And more than 1/3 of the adults are obese. And during this pandemic, I just can't express, even I have put on weight. Okay, because we were, inside the houses, not stepping out. All the gyms are closed, exercises are closed, sports and games are not there for the student. Even teachers are sitting in front of the system hours together to have their online classes. Okay, so we have various, problems, and then definitely whatever the inputs given by the previous panelists was really helpful, whatever you told, the tips and all. And while sound diet and nutrition are just vital, students and teachers should exercise and burn enough calories to be healthy and combat that obesity. So exercise is the solution, where it's not that we just cannot say only teachers have to do, only in the schooling it has to be, only the child has to do the exercise, but a parent also need to be oriented when they come for the orientation or when they come for the PTM. When you find that the child is obese, definitely we need to orient the parent and then guide the parent, to take some, a kind of exercises at home as well in the early hours or maybe after school hours. So anyhow, in the school hours, we'll be having sports and games. Apart from that, obese means it is something to be done apart from the schooling also. So then definitely parent has to put in a little bit of effort in making the child healthy. So beyond supporting the sports and physical education, we consider standing desk as the serve a dual purpose of heightening concentration and cognitive activity while burning the calories. If your classroom is a sitting classroom for all the teachers and whoever is the teaching with respect to education sectors, if your classroom is a sitting one, you need to arrange for the class to stand up, stretch and take breaks at regular intervals. So generally we have 8 periods or 9 periods of classes, and then there are no physical activities and you're making them sit for all the 8-9 periods. Definitely, whatever the kind of instructions are going in the class, the child might not accept, as it is like first 2 periods, whatever happens, it might not be the same intake in the last 2 periods. So definitely we need to make such kind of activities where the child can, stretch, make them stand and, give them little bit of break, and then regular intervals. Instead of giving only 1 or 2 intervals, we can give an extra interval also if required when we are facing these kind of problems. So schools cannot achieve their primary mission of education if students and staff are not healthy and fit physically, mentally and socially. So children who are sick, hungry, abused, using drugs, who feel that nobody cares, or who may be distracted by the family problems, are unlikely to learn well, actually. So then what Ms. Radhika has told, like, many points you have covered, ma'am, like, which is very helpful. And all these points have to be noted down by all the teachers and principals who are attending session. So that whatever the point you have spoke about, the good touch and bad touch, is really, really important. So that needs to be, sessions have to be taken by the teachers to all the students. And it's very absolutely required for the present generation, because they have not been guided at home. I may not say that all parents, but few parents, okay, they may not guide the students, but it's our responsibility, the education sector's responsibility, to educate the children at school level by telling them and teaching them. And as you said, ma'am, using the dolls or something like that, we can definitely train the children and make them understand what is that good touch and bad touch. So once a child's lack of progress can impede the learning of the other children in the classroom as well, and education reform efforts are bound to be a limited effectiveness unless health related barriers to learning are directly addressed. So poor physical health and mental health conditions are the barriers that prevents the students from showing up for the school, paying attention in class, restraining their anger, quieting their self-destructive impulses. So in a general survey of the public, like parents and members of the public, consistently rated health as an important topic that school should address. So many parents have visited for this, like, my child is being obese, but the child is not able to get up in the morning because the child, he or she, is lazy to get up. But definitely these are the points which needs to be addressed in the assembly of the school. It might be an online assembly or an offline assembly. We need to address and then, induct the parent also, induct the child also, and then give the instructions to the teachers as well. So like they want more of, dances, yoga classes, sports and games, swimming. Compared to indoor, they want more of outdoor games. Okay, although reliable data on the implementation of school health programs are lacking, there are indications that now, as of now, the most of the schools operate comprehensive coordinated programs designed to systematically address these major health risks. Okay, during this online, it's not a single problem. It's like, it's totally the children have, changed their body shapes because they're stuck to the gadgets and then in front of the screen and all. So it's a tough task for all the schools and all the education sectors when they come back, and then how many years or how many months it is going to take for us to, bring them to a normal, okay, physically as well as mentally also. So then we should try to make the students feel safe about sharing their feelings, especially. This will make it easier to identify, prevent, and deal with the problems. So we need to ask students to do a healthy self-checkup by handing each one a kind of worksheet saying, let's do a self-checkup to know what we are feeling and look at problems or worries that bother us. So like a kind of, using an A, B, C, D, E or F, something like that. Grade how you feel right now and jot your name on the paper, fold it so that no one else can read it. If it is online, probably nobody else can, see their screen. And you don't need to share your grade with the others and all. You can just tell that also to the students. And if it is D or something lower, I think definitely that needs to be addressed individually, privately to the students, and then the same thing has to be conveyed to the parents as well. The mistake what we do is anything which is where the child will be into trouble or something like that, we try to not to transparently convey this message to the parent, but it's cautious that we have to address each and everything which the child is not addressing at home but he's addressing at school. We need to inform the parent because they should also know what kind of problem the child is facing, their own child. Okay, so we can jot down the kind of names of students who seem unhappy, unhealthy, or unstable, and place the folded slips like, anonymously, and help others. So we can have a kind of box, and then we can, it should be checked regularly by a school counselor or other health professional. So in short, like, show that you care to them and you are there for them. So that is how when the child comes and shares with them. So it's like, most of the students, especially 8th upwards, the, girls or boys, they share most of the things with teachers itself, not with the parents. Okay, so this needs to be, I think, they need to be told to the parent, because parent have lot of belief, lot of trust on their kids, but as per the survey also, we all know that as an educationist, as a teacher, as a principal, we all come to know that the child reacts in two ways: at home in one way, at school in another way. Okay, so this needs to be told to the parent. Whenever we see that something is going wrong, alarming, we have to inform the parent as well. So cultivating relationships and then healthy environment is not like a kind of August to September event, or nor it is an annual planner to be worked upon. Rather, it's a kind of lengthy process that continues until the last day of the school. So it establishes the expectation and the norms that students function as, interdependent family members who work together, keep the classroom running smoothly. So then how to foster the growth? How do we foster the growth? So the teacher is responsible not only for students' social and emotional well-being, but also she need to see each student's academic growth as well. While students not need to feel accepted and valued for who they are right now, they also need to see themselves as dynamic individuals with much potential for academic growth. So this belief is essential because students who believe their intelligence is malleable, that is those who have a growth mindset, tend to persevere in the face of a hardship. But in contrast, students who believe that intelligence is static, that is those who have a fixed mindset, tend to shut down on the face of a challenge. This is true whether students see themselves as a high achievers or a low achievers. Students will have the greatest chance for success if they both, they and their teacher view intelligence as a seed or a sapling, ripe for the growth. So then the bottom line is that both the learner and the teacher expect to see the growth. If they don't, they adjust tending and, trimming as needed until the roots grow down and shoots grow. So this cycle fosters hope and then persistence. Hope and persistence are the two key indicators of a family's health and well-being. And also it's important to introduce the idea of differentiation as a method for promoting the growth. If students recognize that each classmate is a unique individual with varying strengths and needs, then it will make a sense that, different students require different kinds of, tending and, trimming. So addressing these realities early in the school year invites the students to adopt expectation that different learners will need more, different tools and tasks to grow. So like we are family, we need to give that, just as with the actual families, no classroom family is perfect. But by celebrating the students' unique qualities, cultivating the relationships, and fostering a growth of mindset as well as grouping flexibly to strengthen their pursuits, teachers can sustain the health of the classroom community. So like I would like to share one small snippets. I just come to the end of my session. A small snippet. Can I share my screen?
Yes, ma'am, you can share.
Yeah.
Yes, it has started.
I think I'm there in the first screen.
This is the last slide, I
Yeah.
think.
One second. Just give me, I'll just. Okay, so this is very interesting when, stop hearing, start listening. A child comes home saying that I have so-and-so problem. The mother, or somebody at home, they're just hearing. Hearing is nothing but, you're not listening to them. So listening is something which you accept what the child is, and then you give a solution to the child. Okay, so we should always stop hearing that when a child comes from school or a student, comes home, a boy or a girl, we need to listen to them. What is their problem? They want to share their whatever problems they have, or maybe their happiness and all. We should give an eye, and then rather than hearing and overhearing, we have to listen to the kid. That is what I would request all the parents and students, and all the teachers also. Please convey this. You need to convey, orient the parent to start listening to the child. Okay. And then counseling is very, very important. A child has so many things rolling out in her girl, and then nobody is there to help her out. She is unable to say something, few things which are, she cannot tell at home. That is the reason we need counselors at school level, wherein we can help out the child. We need to kind of do a kind of testing. If the child is sitting in a corner, not mingling with the students, not mingling with the teachers and all, definitely it's our responsibility to identify why the child is sitting idle, not showing any interest. Maybe she is having some problem. Okay, so we just cannot judge or label a child saying that no, she's like that. No, absolutely no. We have to consider this and then call the student, and then probably individually we need to address. If not, there is no solution from teachers, and definitely counseling is required for the child. And then balancing is very, very important. This is what we need to teach the children, how to balance the co-curricular activities, curriculum, home, friends, neighbors. This is what we need to educate. So there is John Davis one quote is there, which is very interesting, and I love that quote. And in every session which I take up, I always tell this: education is not life, but life itself is education. So we need to teach them how to face the society. Now, marks are not important, but educating them how to face the challenges is very, very important. So we need to guide them for their right path. This is very, very important. And we need to nurture them. We need to handhold them if they have any problem. Say, for example, new staff joins, or a new principal joins, or a new child is in the class. The child or any staff need to be hand-holded and need to be told about the policies and protocols, how we follow, what is a regular routine. Definitely, whether it is a child or a staff, definitely they need to be hand-holded. And then, of course, a wholesome schooling is nothing but a awesome growing. So thank you so much, Sharp Team, for giving this opportunity. And if any queries with respect to this, you can place in the box, and then I will address to you. Thank you so much. I'll
Thank
stop.
you so much, ma'am. The insight is very valuable for all of us. Thank you so much for sharing your valuable views. I would like to welcome our next panelist, Ms. Shobika Ghai. She has a master's degree in social work and specializes in women-centered practices. She has always been passionate about driving social change through empowerment and upskilling. Prior to joining Spark Minda, she had worked extensively with communities on issues of gender, health, and capacity building. At Spark Minda Foundation, she monitors and manages the day-to-day functions of projects and spearheads women's healthcare program. We welcome you, and over to you, ma'am.
Thank you, Lisa, for the introduction. Hello, Sharon. Thank you, Sujata ma'am. That was very insightful. I think everybody here has on the panel has covered really important topics that needed to be covered when talking about health in schools. I will just quickly share my screen or for 2 minutes talk about what we do at Spark Minda in the field of health and an important issue which is very close to our heart and to my heart and a taboo in India and something that I think we should address in schools. So yeah, I'll just okay. Right. So what do we do at Spark Minda? We have 6 intervention areas: livelihood, empowerment of persons with disability, education, community infrastructure, environment, and healthcare. Today, I'm just going to limit myself and talk about the healthcare initiatives that we take. In the field of health and education, what we do is we have skill centers in 5 states of India: Uttar Pradesh, Uttarakhand, Maharashtra, Tamil Nadu, and Haryana. Here we have classes in computers, industrial tailoring, spoken English, beauty, wellness. What we do along with these classes is because we understand that education cannot just be what we teach in classrooms, on paper, or on computers. We have incorporated a soft skill training module within these sessions, within these classes. So they could be 3 month classes or 6 month classes. But we, as part of these programs, people are also given wash trainings, menstrual hygiene workshops, trainings on how to talk about your feelings, how to give presentations, how to basically speak out. We also have some projects, a couple of computer classes that we take in schools in Tamil Nadu and schools in Uttarakhand, where these programs are held on every Saturday, and we've named them Saturday activities so that students want to come and listen to us and be participative in these sessions. We have a women's healthcare program that we run in our project states: Tamil Nadu, Uttarakhand, Uttar Pradesh, Maharashtra, and Haryana, and also in 17 prisons of Haryana. As part of this program, we do capacity building of females to take care of their own menstrual hygiene. We talk about the myths and taboos that surround menstrual hygiene and try to understand the issues that they face from day to day. Initially, we generally provide them with sanitary napkins, but as a part of this project, we teach people to make their own sanitary napkins because we believe that healthcare should be about capacity building, about telling people how to take care of their own health, how to take care of themselves. So, because we will not, as facilitators or any non-profit organization, community intervention, cannot provide support to people forever. So what we can do is we can increase knowledge, we can disseminate knowledge about these issues so that generations to come are not impacted by the issues that previous generations have. So because a small group of people cannot make change. People themselves have to have the capacity to change their lives, and it is our job to build that capacity. So we also do eye healthcare camps and blood donation camps. But why promote health in schools? I think what Tina ji spoke about, early life interventions actually help inculcate knowledge and develop capacity of people to look after themselves. Something as basic as wash trainings at an early age help reduce communicable diseases such like diarrhea, cold infections, and but all of that already has been covered by Tina ji. What I want to talk about today is menstrual hygiene. With mental health, both of them have been stigmatized a lot in our society. So when I was in school and I had to go to the sick bay or the medical center in my school to collect a sanitary napkin because I forgot to get it from home, and we were never taught how to keep track of our dates. So the nurse used to wrap it up in newspaper. I used to hide it in my pocket, take it to the washroom. And that is something that taught me that menstrual hygiene is something that I should not be talking about. It is something that is very private. And nobody ever told me. For the longest time in my life, I did not know why do I get periods, what are periods about. Not my teachers, not the nurses in school, definitely not at home. My mother just taught me how to use a pad and how this will happen to me every 5 days in a month. And so I think it's very important to include menstrual hygiene knowledge dissemination in schools at an early age, because what happens is that these conversations then can also be passed on to mothers, and the problems that women face at the age of 25, 30, because they don't take care of themselves, because they don't know what to eat when they're going to get their period, how to take care of themselves, how to take care of their uterus. That women in India, especially, more than 50% in women in India are anemic, because we don't know what nutrition to take, or why do we have iron deficiencies, or we don't know how to we don't even know how often we should change our sanitary napkins. Nobody tells us this. So we do sessions in communities, and women in the age of 30, 35 come up to us and say that, oh, we only change it when it's required. We can wear a sanitary napkin up to 12 hours. Even educated people do that. I mean, I'm sure all of us at some point have done this, and we don't realize that there are long-term ramifications to this. Is something that if we were taught about or spoken to about these things at school, then we would, as we grew up, be more equipped. But some of the issues that still exist is the sanitation, toilet facilities in school, the fear, shame, social taboos, which I've talked about, lack of water, disposal facilities. All of these things should be also as part of including health education in school, should also be taken care of by school administration, so that women or girls find it comfortable to use these services. They have clean water, so proper disposal facilities, sanitary napkin vending machines available at school, so that these when they come to school, they don't feel, or they don't take chuttis because, or leaves because they can't, they're on their period. So when we talk about equity or inclusive health, we generally don't talk about issues that specifically a adolescent girl faces. So we should do health training, make girls understand the biology of menstruation. We spend the first 10, 15 years of our lives not knowing why do we menstruate, where does it come from, it is not blood, what kind of blood is it, and just normalize these conversations. And again, I would just not take a lot of time and quickly close by saying that health education should not just be about physical health or mental health or menstrual health, because all of these things are very related. If I am not in a good headspace, or if I am going through something, if I have a mental health issue, it will also impact my uh, physical activity. I might not want to get up from bed. It will also impact my physical health. So everything's very interrelated. A menstruating girl might not feel very comfortable, grow up to be very closed off from people, because she could never talk about her problems or the kind of problems she might face. And yeah, so I mean, somebody here asked that what is the most important aspect of health, and I think health is very holistic, and schools should take everything into account when an approach like this is included in the curriculum. So yeah, I think that's all from my side. Thank you, Sharp, for having me.
Thank you so much. It was very nice. And indeed, this too was a very, very important topic to cover. And let's talk and to talk about it in the setting. Uh, so this year, World Health Day theme focuses on building a fairer and healthier world for everyone. Sharp NGO over the 21 years is striving to improve, maintain, and promote health by reaching out to students and communities all over the country. Here is a video encapsulating our work on different health interventions, which covers general and specialized screening of early detection diseases, educating students through activities, and joining hands with the different stakeholders to build a health promoting school. Before starting the Q&A round, I would like to introduce a short video of our journey showcasing the health programs conducted and successfully implemented in different areas. We mobilized communities, youth centers, in and out of school children and teachers to spread awareness. While we go through the video, I request all the attendees to please post the questions in the Q&A box. The sharpest question of the webinar stands a chance to win a gift voucher of Rs 1,000. Please play the video.
पहले मेरे दांतों में दर्द करता था और आंखों में से पानी भी आता था, पर सार्प, एंजियो और ओलंपिक्स ने मेरे मुश्किल को हल कर दिया।
5 तरीके के पोषक तत्व होते हैं जो अभी खाने में आपको मिलते हैं। पहला वो बोलते हैं कार्बोहाइड्रेट्स।
प्रिंसिपल जीजीआईसी गोमती नगर ऐसे कार्यक्रमों का स्वागत करती हूँ और आशा करती हूँ कि शार्प एनजीओ ऐसे कार्यक्रमों को आगे प्रोत्साहित करता रहेगा, जिससे बच्चों में एक जागरूकता बनी रहेगी।
Thank you, Ritik, for playing the video. The first round of questions, we entered the first round of questions. I request all the audience to please raise your hands that we can unmute you for the live questions. So first, I would like to invite Sharon Patel. Sharon Patel, please unmute yourself.
Yes, good evening all.
Hi, Sharon.
Hello, am I audible, ma'am?
Yes, please introduce yourself
Good evening.
and let us know. Yeah, good evening.
My name is Shireen Patel, ma'am.
Yes, where are you from?
Singhania Public School. Songarh, Singhania
Yes.
Public School, ma'am. JK Association.
Okay, sure. Please go ahead with your question.
Ma'am, my question is that nowadays we see children, they are engaged in using mobile phone and using social media. So it is affecting mental as well as physical health. So as an individual, as a mother, as a teacher, how can I overcome these problems? Instructing them is not just sufficient. So is there any other activity which can help?
Ms. Tina, would you like to answer the question?
Sure. I think our previous speakers have already covered most of the issues, that it is very important if we listen to them, what they are saying, instead of hearing to them. And spending time, it's very, very important, because considering the work from home also for working parents, I think it is although very, very important for them. Initially, I think the excuse was the parents were not at home. But right now, I think most of the parents are working from home. So in this time, in the current scenario, I think it is pressurizing for both, for the parents working, for the working parents, and of course, simultaneously with the online classes. Because I think initially we were just thinking like what they comes with learning with the homework kind of extra studies. But now I think the parents are taking care of their online classes, which they are doing in the classroom levels also, just to make sure that they, I think, as a parent, if I share my experience, like just to make them aware and just to make them to complete their work at the classroom level also. So I think it is very, very important in the current scenario to spend time with kids, innovative ways of involving them in day-to-day activity where they can ensure minimal amount of physical activity in the current scenario. Like the speakers have already emphasized that we are not going for a gym or for activities or for a walk under the current scenario. So I think there has to be some innovative ways within their households, how they can be involved, how the students can be involved little more productively, and so that they can be involved in more physical activity. So I think I'll just reiterate what I think previous speakers have just mentioned. It is very important to listen to them rather than just only hearing to them. Thank you.
Thank you so much, ma'am.
Thank you so much, ma'am. Thank you.
We go to the next participants. Kiran Timothy. I would like to invite Kiran Timothy. Could you please unmute yourself?
Yes, ma'am.
Hi, Kiran. Hi.
Hi. Good evening, ma'am.
Yes.
I'm
Please introduce
Kiran.
yourself. Yes, yes.
I'm Kiran Timothy, the Aditya Birla Public School, Awarpur, District Chandrapur. As an health and physical education teacher, my question is, what can I do to help students also in this current lockdown condition? And what tips can I give them on diet?
Ms. Sujata, would you like to take the question?
Yeah, thank you. Hi, Miss Kiran Timothy. Physical education being a major, co-curricular activity in the school campus, and literally the whole world is suffering with this, and all the kids are having a lot of problems because they are not sent out by the parents, and they're just locked inside the classrooms, and they're becoming obese. Okay, so with respect to this diet and all, we need to tell them continuously, frequently. We need to send messages to the parent to ask them to give many kind of liquids, and then proper nutritional food, and then exercise. So during these classes, hardly 2.5 to 3 hours we are able to interact with the students online, but we can give them a kind of chart, exercise time, food time, water time. If we can give a kind of timetable and guide the parent, that would really be helpful. Okay, so this tip probably even we have done to our children also. We will have liquid time, that is water time. So all the children will go get their bottle and drink water, and then enough of food. What kind of food they're eating also, we need to guide them. Are they eating the junk food, or just like that whatever is left out they're eating, or are they eating hot or cold? What kind of food they're eating, we need to understand. For that we can give a kind of checklist to the students and understand what kind of food the parent is feeding them. Based on that, we can give few suggestions, and then ask them to do exercises also. We can send a video to the parent and tell them this video can be played in the morning. You can have your regular exercise. Apart from that, in your online assembly also, you can ask the children to do exercises, being a physical and education teacher. That's what I could say. Thank you, Kiran.
Thank you so much, ma'am.
Thank you, Kiran. Thank you, ma'am. So our next question is from Anya Nagpal. Anya, please unmute yourself.
Am I audible?
Yes. Hi, Anya. Please introduce yourself.
Hello, everybody present. I'm Anya Nagpal from Delhi, studying in Mount Columbus School.
Yes. Please go ahead with your question.
My question is, what is the most important aspect of adolescents' health?
Okay. Ms. Shobika, would you like to answer the question?
Hi, Anya. As I mentioned that health is always holistic. So if you're not physically well, you will not feel best in your mental space. If you're not in a good mental space, it will also impact your physical health. If you're not taking enough nutrition, it's also going to impact your physical health. So health is a very holistic area. There is not just one aspect of health that you should take care of. You should be taking care of your nutrition, any physical problems that you're facing, taking care of your day-to-day hygiene, taking care of your mental health. If you feel like if you are having mood swings, or you're not being listened to enough, or you have nobody to talk to, then also you should talk to somebody. So I don't think that adolescent health only has one problem, but these days, with the rise in technology and the fact that we're closed in at our homes, I think mental health has become a very serious problem. And also because it's stigmatized a lot in our society, we don't talk about it enough. Our parents also do not have the same understanding of mental health that maybe the younger generation does growingly. Being able to have these conversations and being able to talk to people, having people around, and is very important. So I would say everything, but also today mental health.
Thank you, ma'am.
Thank you, Shobhika. So the next question is from Vidya. Vidya Mane. Vidya, please unmute yourself. Vidya. So the question from Vidya is, in present scenario, work from home and 24/7 availability is expected by the job providers too. So the question is that how to balance mental, emotional, physical health as a working woman. Anybody can take up this question.
Can I?
Yeah, sure, ma'am.
Yeah, Miss Vidya, your question is apt for the present scenario. So 24/7 availability. See, it's not that only woman has to take responsibility at home. Only a wife has to do, only a mother has to do. We need to give, share our work. That is how we educate the children, educate the family. Every member in the family has to be given some kind of work delegation. It's not a one-man show, it's not a one-woman show. Definitely we need to take help from the family members, and then that is how you can organize things and you can have a little bit of balancing task, or else definitely you are under a lot of mental and emotional stress. You will be very much imbalanced, which is going to affect your health. So definitely work has to be done by all the family members. It's not like one woman show. And then irrespective of a boy or a girl or a grandfather or a grandmother or a brother-in-law, sister, whoever it is, a kind of task what they can do. Okay, definitely needs to be, it can be a simple dusting. Okay, it can be done by any of the family member. It's our house. That is how we need to educate the children also, to help your parents, help your grandparents. So definitely, if it is organized in that way, you can work happily at home, at school also. With my experience, I'm saying this. Thank you so much.
Thank you so much, ma'am. I hope, Kiran, you got your answer. Sorry, Vidya, you got your answer. And now we have come to the end of the session. I would like to thank all the panelists who have joined today and taken time out for this webinar. Ms. Tina ma'am, Ms. Sujata ma'am, and Dr. Radhika and Shobhika, Ms. Shobhika. Thank you so much for taking out the time and joining us today and discussing a lot about adolescent health and touching various topics under it. Today we have talked about menstrual health and hygiene, sexual reproductive health, mental health and physical health, and nutrition also. Thank you so much. Any of the panelists would like to say anything?
Thank you, Sharon, Elisa, and Ritik for organizing it so well, and thank you for having us today.
Yeah, I think
so
great effort, great presence, I think, in terms of the school participation. So really nice to be a part of this webinar. Thank you for inviting. Thank you.
Thank you, Sharon. Thank you, everyone, all the panelists, and thank you, Sharp team, so for giving me an opportunity to talk to all the 300 participants here. I've seen many questions posed by people. Like there was one interesting question saying that good touch and bad touch can be done for girls. Why not for boys? Okay, irrespective of the gender, it has to be addressed because it's very, very important in order to what is that, instruct a child and guide them. Okay, irrespective of the gender, irrespective of the age, these kind of sessions are very, very important, and we should motivate them and guide them. Okay, it's not only for girls, it's for boys also. Everybody need to be inducted about the good touch and bad touch. So that is the reason we started right from the young age, at the age of 8, 9 kind of age we can start, and then this can be taken up by all the schools, which will really help the parents and all the students. And there was also another question where something like I'll just open that question. That was also, yeah, parents about the change of behavior, but parents need any proof. Okay, absolutely. Okay, we don't give the kind of proof where the child's morale is lowered somewhere, something like that. We need to, how to approach the parent in this particular scenario is, you need to tell them, this is what we have noticed. This is what the kind of change we have noticed in your child. We request you to please monitor and let us know your feedback. Give them little time to monitor, and then based on that, the further step. No parent will accept that the child is doing something bad, because that is a trust. It's a blood relation. Okay, they don't trust. And we need not give a solid evidence to prove that the child is wrong, but we need to tell them that something we have noticed like this. We request you to please monitor at home also. And then you can call them, have a discussion, and then that is how we can resolve the issue. And thank you so much for giving this opportunity, Sharp team. I'm very happy to take up this session and then give a lot of queries to the audience. Thank you so much.
Thank you so much, ma'am. Now we come to the exciting part of the webinar, that is the winner of the sharpest question. Aliza, would you like to announce the winner?
Yes, so for today's webinar, the winner of the sharpest question is Kiranti Muti. Many congratulations to you. Anyone from our communication team will contact you for your delivering the hamper. Thank you so much.
Thank you. Thank you so much. Thanks a lot, ma'am.
Over to you, Sharon.
Now we have a feedback form for everyone right upon your screen. Kindly fill the feedback form. Your certificates will be mailed to you within 48 hours. And you please also check your spam box to find the certificate. I once again thank everyone who attended the webinar today. And for further updates on our projects and also for the webinar, please subscribe www.schoolindia.org.in. As a part of the early intervention program, SHARP is conducting school health camps pan-India, which focuses on general and specialized screening for children. We wish the principal teachers to support this program by registering their school in the link given in the screen. And also the link is dropped in the chat box also. I once again thank everyone who attended the webinar and also our dear panelists. Thank you so much. Hoping to meet you for the next webinar next Saturday. Thank you.
Thank you all the attendees and panelists.